everybody. Welcome to Talking Data Equity for Friday, March 27th. And my name is Heather Kraus. I am really happy that you have found your way to Talking Data Equity. Talking Data Equity is a speaker series that is organized and sponsored by my organization, which is called We All Count. And my organization builds tools and provides trainings for anybody working on a data project that they want to have the choices that they're making in their data project align with their community priorities and their stated values. And one of the things that we do, and this is, we're just going into our 5th year of doing this, is we host a informal drop-in speaker series on Fridays. The point of which is to have a space where at the end of the week, you can hang out with other people from around the world, from across all kinds of different sectors who are actually trying step by step to embed some equity in their data projects. So you can remember that you are not alone. You are not the only person doing this. Whatever geography you're in, whatever political climate you're in, there are other people doing this. And every single Friday is different. And this Friday, we have a special guest who's going to share a little bit about their work. And I'm going to introduce a special guest to you in just a couple of seconds. Before I do that, I know there's a lot of new people today, which is great. Welcome. If you have found your way here today, the Zoom link that you used today is the same Zoom link that we use every Friday. Yes, we have used the same Zoom link for almost 5 years. No trolls. And so let's try and keep it that way. The little nice corner of the internet here. And you can find us. I will put the Talking Data Equity link into the chat right now, and you can always go there to see what we're doing and decide if you would like to attend live. And if you'd like to attend, but you can't attend live, you can always find the recordings and all of the resources of what we talked about and what we experienced together in our data equity forum. And I put the data equity forum link there too. That's not a membership site, it's public good. You can just drop in there at any time. Okay, I would really like to stop talking soon and introduce you to our special guest. Our special guest is coming to you today from the same city that I'm in. So I'm very excited. A fellow Torontonian whose work I have admired for a long time. And many months ago, we chose this date. Let me welcome Jemal Demeke. And we're so grateful that you made time to join us today. Jemal is a researcher at the Wellesley Institute. Now, if you're Canadian, you definitely already know what the Wellesley Institute is, most likely, because the Wellesley Institute is kind of a beacon in terms of health equity in our country. And Jemal is a researcher at the Wellesley Institute, specializing in science and technology studies, critical data studies, and health policy. With a background spanning biological science, clinical trials, and community health programs, he brings a system level perspective to the use of socio-demographic data and community data governance, which is a hugely important issue in the current age of data and AI. And Jemal is currently pursuing his master's in AI and health systems research at the University of Toronto, exploring the intersection of health law and policy in the context of data justice. So you can see Jemal is very busy. And so it is with great pleasure that I now turn over the screen and the mic. I forgot to say, if you have questions or reflections or anything like that, put them into the chat right now. Keep your microphones turned off. And at the very end, if we have time, we'll do Q&A. So with great pleasure, Jemal, let me turn it over to you. Thank you so much for making time.
Hey, no, thank you for making the space for me. This is exciting to talk to, a whole different group of people. So I'm going to put up my slides now. One thing I will say is I just remembered we went through a rebrand recently, which means we have a different presentation template. I'm not great at comms things, so I was quickly fixing some of those things. If you notice kinks along the way, exclude them. I'm a researcher, as I said. I'm doing my best to make things look good. But yeah, so I'm here to talk about this idea of community data governance that has grown a lot of interest. I know in the Canadian context, but I do know that honestly across the world, United States and other similar countries, that there's similar work happening under different names. This is just the name that we use. And I'll get into what the EGAP framework is and what that looks like. But specifically how I'll do that, so I'll go through first a case study of how we even reached the place that we're at right now, get into community data governance as a concept and the framework, and then I'll talk about some previously completed efforts around this idea and then current ones that are ongoing. So there's this phrase that is often used, right? Necessity is the parent of invention, meaning when, like things will take time, change, you got to be patient. But then sometimes we actually don't have to be patient. And all of a sudden, everything that we need done happens so quickly. And this is something that we saw during the pandemic, right? A lot of quick mobilization of resources, changing of like, health system structures, understanding the fact that if we don't do this, people will, be in trouble fast. And so we need to change the way that we do respond. Um, so here in Canada, the major thing is we haven't had a lot of sociodemographic data and focusing specifically on Black communities, we didn't have the same data to demonstrate that Black populations are experiencing higher infection rates as we were able to see in research in the United Kingdom and the United States. Now, we did not take this to mean that we are immune to all the systemic disparities that cause these, disproportionate rates. We understood that it's just the fact that we don't have the data to demonstrate it. And so there's a growing focus on Black communities and the disparities that exist and the reasons why, right? The social determinants of health, talking about housing, talking about income, and at the time, right, access to masks and, using public transportation, the list goes on. And a lot of people here, researchers, advocates, were trying to bring exposure to that. And if we also draw back to that time, right, we do remember the rise of, or I guess I should say almost even resurgence of the Black Lives Matter movement at the time that drew an extra focus on Black communities, which in the policy space brought a lot of resources, but for Black community members, it brought extra trauma, honestly, right? It brought extra work that had to happen during the pandemic on top of, figuring out if you're safe from this infectious disease. It's worries about if you're safe just going outside. And so that brought an extra need, right, to have some type of policy response that accommodates and responds to all of these additional concerns that Black communities were having. And so, again, here in Ontario, a province in Canada, there's a group of us who then thought, okay, well, we need to have this data together immediately. Like I think it was by the end of March, like a couple days before the first day of April, they already wrote a letter to our premier, which is kind of like our, the state governor, like the person in charge of our province who's saying that we need this data and not just need to collect it, we need to use it to be able to demonstrate that all the issues that we're seeing around the world are actually happening here. That we need to substantiate this so people cannot ignore that it's going on. And so these group of people call themselves the Black Health Equity Working Group, made up of clinicians, community health organization advocates, people who are in charge of health agencies, people involved in our Ministry of Health and government systems. And they said that their mandate was to have data to identify and track disparities, and in the end, to create evidence-informed, community-driven public health and policy solutions. And so then the work, creating a catchy group name, Black Health Equity Working Group, and having a mandate is the easy part. But now the work began to push for sociodemographic data in Ontario. So the thing is that there were no individual level sociodemographic data available. But that does not mean that the work ends there. that we recognized that we had like kind of area level analyses using our postal codes, our zip codes, right? To be able to identify what's going on in specific areas. And what did we learn in doing that? Well, I'll walk you through in a sec for those who are not familiar with Toronto, but we're able to see that the cumulative cases of COVID-19 varied up to 10 times by area. And so this is a map of the, kind of city of Toronto proper. And what is most commonly seen is that these areas in the darker red, which are representing areas with higher rates of COVID-19, are often the areas that we see many other health conditions that having greater disparities. And I'll show in a second some of the other correlations that we were able to see. But yeah, this northwest corridor and around here in the east part wasn't surprising. And so then wanted to take it a step further to see, okay, well, these areas with higher rates, what are we also able to see? Well, these areas often have higher proportions of racialized populations just living in the area, right? Which isn't an issue on its own, but right when we just bring it into the COVID-19 rates, it warrants some further examination. But we also see those areas having higher rates of overcrowded housing, meaning people, were not able to um, quarantine or isolate, when they needed. People who also needed to commute on public transit. Again, you're seeing similar areas. And then also higher area, these same neighborhoods are considered primary care deserts. So the darker the orange, meaning that they have a high need, but low availability of primary care, and the blue representing a lower need, but higher availability of primary care, right? So you can see that disparity there. And so this made waves, right? It's not going to be surprising, especially maybe now a couple years later, but at the time, this was pretty groundbreaking, unfortunately, because we didn't have the data at all to demonstrate this in Ontario. So this was the first time, and it created waves of change. So then we saw different public health units. So London and Middlesex, which is just another area of Toronto, Peel, a very large area next to Toronto, and the Toronto Public Health Unit started to collect data in May. You see immediately in June that the province of Ontario changed the law to allow the provincial collection of race-based data, because before it was just an individual public health unit. If they're interested, they could go ahead and do this. But now a portal was created so that they could submit their data and we could have more provincial-wide analyses available. And so then that's when also the City of Toronto analyzed the data with communities to develop an equity plan in August. So if we come back to that initial phrase again of necessity being the parent of invention, people have been asking for this data for a very long time, right? This wasn't a pandemic thing that everyone was realizing that this was needed. It was just, again, the fact that when things are moving fast, you have to think creatively, right, in the health system and mobilize. And so what happened? So I'm about to show a figure where this is going to be the rate ratio of COVID-19 comparing Black populations to white populations in the city of Toronto. So that's what the 0, 1, 2, 3, 4, like how many times the rate of the white population did Black communities have COVID-19 infections. And this will be across June to December of 2020. So we're able to see from the summer, June, July to August, we went from 6 to 9 times now at its highest peak, what the rate ratio of COVID-19 infections in August. If you want to remember though, in August is when they started to finalize the community response to COVID-19, when they worked with Black communities and tried to figure out exactly how to address those disparities. And so what happened? Well, we're able to see that the rate ratio decreased. As the momentum and the initiatives were rolled out, the rate ratio was decreasing. And I want you to also remember that there was a huge second wave that happened in the fall of 2020. And despite that wave that was going on, we still saw a decrease in the rate ratio, right? Even though there may have been a greater number of infections, we're seeing the inequities decrease for Black populations. So when you work with communities, when you look at the data through that lens, then that's when we can create change. And so this was able to demonstrate that race-based data can reduce inequities. But a large mandate of the Black Health Equity Working Group was the idea that we need to also think about community involvement and governance, because collecting the data does not necessarily solve a problem on its own. So as a whole, right, in a general sense, what is data governance? Well, just a framework of policies, processes, and controls to ensure that data is accurate, secure, and properly managed within an organization, right? This is a traditional sense, data quality, compliance, making better decision making. And often, traditionally, again, what is often thought about, right, are the people aspects, technology, and process. Like this is a very common kind of a way to understand data governance. And then you have all of these other pieces of stewardship, metadata, privacy, etc., which is great, which is needed and important. But where does mistrust come in? What about community engagement? Where does the role of systemic racism play in any of these factors? It's not there. It's missing. So when we think about the way that we manage our data, communities are not at all integrated into our frameworks, right? Into how people are educated to think about how to responsibly use data. So in this case, race-based data. At the same time, community trust is an important issue, right? Data holds special value to people. So I, always say that data isn't as complicated as I think people make it to be. Like right now, we had the conversation around about AI, right, and consent and stuff. And if you go around and you talk to people, they're always questioning, right? Do I accept these cookies? Do I reject these cookies on this website? I'm saying this to my friend, and all of a sudden an ad is popping up. I don't know what's going on. Chat GPT, like people are talking about these things. Data is on everyone's mind, and so we need to get rid of the narrative that this is something just for technical experts. This isn't everyone's issue. And we need trust from people to ensure that data is high quality and complete. Because otherwise, why would they trust you to tell them more information about them when they already feel like you're extracting so much? And in order to like make change and promote equity and do the things that I just demonstrated in that graph, we have to center trust. And so there's an extra piece around when we think through Black communities that have experienced increased, right, collection of data and extraction without it being used for community benefit. Data collected poorly or analyzed and then leading to harm at an individual and a community level. Or the monetization of data used for political gain. Like there's so much context there. Or even if we think in the pandemic, there was a time that people were trying to explain that Black people are having higher rates of COVID-19 because of some genetic biological determinant, which is not true, but that was happening like just now, right? This isn't some 1960s study, like this is right now. So, um, so we do need to address this. But the thing is, right, how do we increase trust and data collection, right? You're coming to people and saying, like, I want your data, and they're saying, well, I don't want to give it to you. And then where do we go from here? And so that's what the Black Health Equity Working Group started to think through. And that's where they created the EGAP framework. So they talked to a bunch of community members, advocates, health system leaders to think through what is a starting point for how to talk through these issues. So there are these four pillars. First being engagement. So thinking through, as I said, people already want to talk about data and understand its importance. So start to have those conversations with people in the context of whatever data means for you and your organization, right? So some people, if you're a hospital system, you collect lots of data across lots of different areas, whether, in oncology, then the ER, like you have all these different units. So think through those issues. Some people only receive data, right? If they're just a repository or they analyze data on the behalf of a jurisdiction, then they have to think about it in that context where they're not collecting it and think through, okay, what are the things that we can talk to people about? Because their interest is there. And through that cyclical engagement is then when you ask the question, okay, well, if you were to want to be involved in any sort of effort, What does that involvement look like for you? And if you don't, then what do you think is important for those who will be a part of making sure that this data is used safely? And in the end, we come to that second part of governance, the idea of a community governance table, where you're bringing together community members who are going to be able to make decisions around how the data should be managed, when it can be shared, what collection purposes are appropriate, which ones aren't. It can be similar to an REB. Perhaps it's a collection of community organizations. It could be many things. It depends on what your local community thinks at the time, right? There's no standard way to go about this, but there are lots of precedents that we can bring in. Like, let's not think that REBs always existed in research, right? In the context of research, honestly, it's a pretty modern, new innovation that now is standard, but it was created for a reason. And so, what's stopping us from thinking through a similar layer of ethical assurance for marginalized communities? The other part is access. So, what's the point of a governance table making decisions if they don't know what data is even there? So first of all, they need to be aware of what data they're working with. And I think the biggest difficulty a lot of people have is thinking that access means you're providing the raw data to people. When really at the end of the day, most people don't have a use for all the raw data, like community members day to day. Like that, we have to think about more accessible ways of explaining data that there is. There's nothing stopping you from showing a graph similar to what I did of, what data that you have available, or just presenting on it, talking it through, and then giving enough context so that they can say, well, these are the access rights that we want to provide for this organization. We don't want a certain group of people to be able to have this data unless they go through this training. I don't know. There's lots of things that they can do under the access pillar, right, to talk about. And lastly, protections is, I mean, the integrity of the table and its decisions lies ultimately in the ability to protect the data in the way that they said. So whether it's an individual level data, whether you're thinking of just even analyses that are being created, like the graph that I presented, right? Perhaps they'll want certain nuances presented. Maybe there are certain narratives. Like, that's all a way to protect the data and make sure that it is held and presented in a way that is appropriate. That's at a high level what the EGAP framework is. Again, I'm always happy to talk a bit more about it later, but I just want to now talk through another initiative that we did where there was a bunch of health service providers that piloted EGAP in Toronto region. So as part of the anti-racism strategy in 2021, EGAP implementation was there. And so essentially, we looked at in the UK, there's a health equity audit cycle that they have, a process of how to take data and action it, right, in an equitable way. And so we modified this a bit and we gave it to those health system providers that said that they were going to come forward and they're going to try and do it. So we had hospitals, community health centers, and Ontario health teams, which are sort of like a regional level group or association of providers to help kind of coordinate services in a geographic area. And my role was to meet with them individually, go to any events that they had with community members, any meetings that they had with their, execs or teammates as they're talking through and presenting on what EGAP is and what changes that they're making. So I would just take lots of rigorous notes. And in the end, what my job was to develop a guide on how to scale this up regionally, take those lessons learned for EGAP. So in that journey, there are kind of three larger themes that I built out. So first was just a commitment to organizational change. And in that is implied is, honestly, no one got to the level of having a community governance table in 8 months. I think, and that's not a bad thing. I'm not saying that in any derogatory way. I'm saying this explicitly so that people understand when they start this journey that you're not going to get this done in 8 months, right? In a year. That there has to be a lot of internal shifts to create and make sure that this work can be carried forward. So building an equity-oriented culture. Do you even have an equity team or division that's there? Do they exist in a silo? And are they responsible for all equity profiles, or do they just support different areas, right, that do work in equity? Because that the latter explanation that I just provided is what works more, right? Where they are just additional support to lots of teams because they shouldn't just be responsible for doing everything. Making sure that like HR will need to be involved, communications will need to be involved, your clinical programs and operational teams have to be there, education, the list goes on. And so your workforce structure also has to adapt a bit to allow EGAP to be kind of understood. People need to be aware, right? So that requires also a lot of presentations, talks, asking questions. This isn't going to be a one and done type of town hall that you can set, and then everyone's going to walk away understanding. And then there's also thinking through how institutionally you um, prioritize any sort of initiative. So one partner specifically in their board or at their board level, they had an objective to have the number of staff or physicians to reflect the diversity of the population of the city of Toronto. And because that was there at the board level, that brought a lot of, resources together to make sure that once they, in their next, I think, 5 years or what have you, that they have enough work to demonstrate that this goes on, that now the CEO is taking it seriously. So you have to think creatively and you have to be strategic in where you apply EGAP because it can't just be a for fun, like, extracurricular activity. It has to be a real commitment. And then also one thing important to say is that you have to be aware that not everyone is going to be on the same page immediately. Even in this case, focusing on, Black communities. Like, some people may have reactions to that, whatever communities that you decide to prioritize. And so making sure that people like leadership and those who are pushing this work are aware that this will happen before it happens is will help you, will go a long way. Because negative reactions to change are actually quite common when we look at history, right? No one, looked at when, or not, I shouldn't say no one, but we quite often see throughout history when segregation, ended, civil rights movement, there are lots of people who are angry. Does that mean that they were right? No. So similarly, just because you're having a lot of negative reactions to now Black people having a presence in data governance does not mean that it is a bad thing. It just means you're experiencing sociology. I don't know, So you just have to be able to prepare yourself, have the FAQs together, have your comms team help draft, statements so that you can be ready to address it when it comes. Another important part is the building capacity for equitable data practices. And so this is specifically now referring to those quote unquote data experts who are often kind of removed from anything to do with equity at many organizations. Your analysts, software engineers, programmers, people, who clean the data, who, all of those types of things, QI, that you need to bring them in. You have to. They can't be removed. But like from the very, very, very beginning. And so that honestly will take a time. And this isn't any, negative comment on those teams. It's the fact that education that they are provided, right, does not at all ever mention any of these topics. So there's going to be a lot of capacity building that you're going to have to do there. And that's okay, right? Again, this work takes time. And as long as you're receptive and you have leadership support, and that's why it's important again to have those commitments so that everyone understands that we need to do this, right? It's not you coming pushing it onto them. It's that you're trying to figure it out together because you're all expected to create change together. So then the second part is you can ask the right questions around, how does our EMR system perhaps work, right? Who can see data? How can you restrict certain people from viewing it? Are there warehouses that this data is sent now, even with the AI, right? Like are there any pilot programs that are going on that I don't know about that we want to be careful for? There's there was one provider who started collecting sociodemographic data on their staff before they did their patients so that they can first understand what's going on. And there's a lot more allowances and creativity in what you can do for staff versus patients. And so they actually contacted or have had a contract with a separate vendor where they sent the data of their staff there. And then they're able to, in their contract, write out who can see the data and who can't. And it was specifically within the equity team. And these are the requirements that they would need to have in order to receive any of the data on their staff. Right. And so that's an outside environment. And then that way it's not beholden to some of the tricky ways that this data can be accessed if it was stored in their regular HR systems, because then in that case, anyone in HR would have been able to see their data. So that's what one hospital did. And then lastly is the collaboration with partners and communities. So there's multiple levels to this. One is the internal collaboration. As I kind of mentioned, there are lots of different departments, teams, divisions that will be necessary. You got to wrangle them all in. Without that, you won't go far. I think, as we all know, unfortunately, silos is the biggest, um, challenge that lots of organizations face, healthcare and beyond, on doing any type of initiative. And so don't think that this will be any different. And that, you start with your coalition of the willing, you figure out which leaders are willing to bring this forward, to advocate this in meetings that you won't have access to, right? And as you think strategically through that and build the momentum and get more engagement, that's how you get more resources. That's how you get more long-term commitment. So that as your budget year to year is being cut and everyone's asked to cut something, right? That this is a consistent focus everywhere. And that if one team has to drop this, it's not a total catastrophe because there are resources across different areas dedicated to this. And then there's also the part of external collaboration. So hospitals were talking to other hospitals, CHCs to other CHCs. I think what really worked about that is that you're able to learn from other organizations from their journey and borrow from each other. And then there's a little aspect, it's kind of fun. It was fun for me to watch and see and hear about. And I mean, some of these organizations are quote unquote like competitors in a way, right? So you kind of lean into that a little. I hear this organization is already doing this is not. What are we doing? So that brings a little bit of a push to make sure that you're keeping up. And so if the people who are doing it internally are talking externally and they haven't, their ears to the ground, that's how you're able to do that, right? And build, yeah, a coalition of the willing across an entire region. I think that's hugely important. And then also there's the part that, talking with communities themselves. And this was the part that not many organizations got to the point during this study. I know now because this was 2 years ago, I think. And now I know some of them have done focus groups and stuff with communities, but at the time only one of them did. But I was able to attend that focus group. And the Black community members, they loved what they were learning about. They were like intrigued. It was at this one was, in this mall in this area that a lot of people frequent already, and then another one was in a community health center that was also at this like junction where a lot of buses stop here in Toronto. So it was again perfect, accessible, and I think that's what allowed them to be successful. And they were just explaining things about data and why they're trying to collect it. And I mean, people have thoughts to share. I'm not going to go over all the details, but what I like that's just what I want to demonstrate that it works. And that it was, if you look at the grand scheme of things, pretty small. I don't know, like 10 people, but I don't think that that's small to me personally, especially if you're just starting. Because what you do with those 10 people is you say, well, we talked to like 10 people in our community and they said, and these are their issues. Maybe then we should talk to more people to see, is this something that is consistent, something that is different, right? It gives you momentum. So I don't want anyone to think that their first engagement event has to be like a 300 people, turnout. Um, the most important part is just starting with anything. Because I always say it's harder to create than to critique. So do the create part. People will critique you. That's easy. And if anything, critique yourself and say, well, I want the opportunity to fix what I didn't do last time with another piece of work. So yeah, So these are some of the learnings. And again, this is on our website, the full report, if you're curious. But again, I'm always happy to answer more questions. But beyond EGAP, I just want to talk a bit about some of the other works that we do. So there are numerous provincial efforts to collect and use race-based data. So we have in Nova Scotia, which is over here, they started collecting race-based data in fall of 2021. And then in Manitoba, we were able to see that race and sociodemographic data collection. We're starting at point of contact. So when patients were coming in to the hospital, the admin would ask. And then in British Columbia, BC over here, a survey was actually launched to sample the population of the entire province. And then they wanted to link that data to all the other data holdings they have so that they can see the demographic kind of spread of each of their services and see where the issues are. So what was interesting is a lot of this was happening, but no one was talking to each other. And the interesting thing is these are very different methods of collecting race-based data and trying to use it. It doesn't mean that any one is bad or the other, right? They're all just getting the work done. But we thought it would be useful to talk. So I just tried to, cold called, emailed, tried to find someone to talk to, and that's how I got more information. And so I managed to talk to people from other provinces, in New Brunswick, Newfoundland, uh, in Saskatchewan as well. So it was, and at our national level as well, to try and just say, okay, well, this work is happening. Let's work as a team. And as we talked through things, well, we understood that people really love the opportunity to speak to each other. Um, Especially because I wanted to stop playing broken telephone between 25 different groups. So after meeting with each other a couple times, they said a summit would be a great idea to put some visibility to this and build some communal accountability. If you remember what I said about, the different organizations being competitors and that brings some push, well, that works also at a higher political level sometimes as well. And so that's what we wanted to do and we were able to achieve. And we had about 140 people, so 100 in person, 40 people online that attended. And you were able to see the agenda and the slides of um, all of the presenters on our website as well. And you can see all the details of their collection strategy, their use strategy, if they had a governance strategy as well, like you're able to see that. So those resources are there. And so the group started building and we had our Canadian Institute for Health Information, CIHI. So what I'm trying to demonstrate is that also there's some healthcare-esque adjacent, adjacent organizations that also had an interest. Our Federal Anti-Racism Secretariat, I mean, PHAC, which is like a large, huge, a national level view of this, Human Rights Commission, and our Information and Privacy Commissioner as well. So these organizations that aren't typically, other than PHAC and CIHI, are typically involved in our health system, or you would think, are also interested in race-based data and its governance. And these are the pieces, right? The law is very important, right? Having like a policy view of things are very important to making sure that our governance strategy works. And so that's the movement that's happening around community data governance. And the last piece that I'll end on is talking about the City of Toronto. So the City of Toronto, as a municipality, they govern lots of diverse data sets, and they were focused on building a strategic plan to address inequities. The thing is, for us, when they approached us to do this, to partner with them on this, they didn't just have healthcare data. They had housing, child welfare, justice data. So there's lots of different data sets for us to think about, but community data governance is still important. And so we wanted to build a framework. And so through building that framework, we were thinking, okay, well, we're going to need a lot of information to start. And so that's where I did a literature review, which is on our website with lots of findings around how different government systems are doing community data governance. And that's where I was able to find out that, again, lots of different jurisdictions outside Canada are doing this work, but again, under different names. And then did an internal scan where I talked to the city manager's office, city clerks, their IT team, policy team, people who work with communities directly to try and understand, right? Okay, if I have the best practices from the literature, I need to know where I'm starting. Like, with what are the challenges? What are the issues? Because I need this framework to respond to the issues. There's no point in just, saying what's already been said. We also had an advisory circle of people who have done similar initiatives locally who could strategically provide some guidance to us as we're going on this journey. Because again, we're going outside the health system. So we quite honestly may not recognize that there are other pieces, other movements happening. And we wanted to make sure that that work was also informing our framework. And lastly, we did a bunch of community and stakeholder engagements. So, focus groups, we held them all in libraries for community members where they're able to attend, gave them food, talked about data. And again, that's where I was able to see people love talking about this. They're interested. But then we also talked to, lawyers, people who worked in tech, shelters, people who operated shelters, who have Black focused community organizations as well. Food, like the list went on. We tried to cover as many areas as the city covers services, which was a lot. I mean, it is all, honestly, it's pretty wild to think about. Within 11 months, we came out with the framework. Um, and so that's what I'm about to show you. So we had these principles, which is one, data used for progress, right? This shouldn't be a static thing, right? Collecting data isn't it. Like there's no point in having it unless you're creating change. And in the end, also, there needs to be a strong accountability piece and transparency. And I can talk through what community, like people meant when they said that, and if you are curious later. But again, the principles also were supposed to lead to these outcomes, which are to build trust with Black communities through engagement, center Black voices and decision making on data, and lastly, data is used for good of Black communities, which is pretty similar to the principle of data used for progress. It's intentional that it starts there and it ends there, right? So that we always remember that it's moving at all times. So the way that the framework is built is that there's kind of three levels or three objectives. The first objective that honestly you'll see pretty similar to EGAP. I shouldn't even say similar, it's identical. um, because what we understood is that there needs to be that creation of a space to talk about these ideas with community members to begin with. What does engagement look like with the City of Toronto? Where are the issues with trust? Are there some divisions that are trusted more than others that should be leading these engagements? And those sorts of things. And then there's the part of, okay, let's say we got community on board. Well, we can't do anything unless again, right, your house is in order. So we need to look internally to see or to work towards building a data ecosystem that can track equitable outcomes. So first is responsibility, which is around the roles and responsibility, having the institutional structure that can make sure that this work gets done and thinking long term as well, right? This can't just be, again, someone's activity that's added to an additional role. There isn't even a chief data officer, right? Some of those even very fundamental things, and that if you were to create a chief data officer, that this community governance work would have to sit under them. Then there's the architecture piece because we understood that there was so many different data systems that the city was working it with, which can be fine and sometimes has to be fine. Let's say like their court operations, they do it in the city, but they're actually on the behalf of the province. So it's not even their own data system, right? They're using a provincial one. So we need to think through, okay, well, how do we track, is there maybe metadata that we need to create to be able to track what's happening with the data as it moves across the city? Because if someone provides consent in a very specific way, we need to be able to manage that and hold that and honor that. And then there's the standards part, which is just having more templates on agreements, right? Data collection forms, what have you. It's okay to be different. Like not everything has to be the exact same, but if we start from the same foundation and we go and we tweak our documents in different ways based on our own context, that's okay. But that's the place that we're trying to get at. It's just having the most basic fundamental agreements together. And then lastly, is that the city can now, right? If we think the communities are together, the inside is together, now let's go. So they're harnessing community data to drive action. Management as in change management, right? So are you measuring progress? How are you evaluating what you're doing? How are you motivating people to keep going? Do you have, let's say, honestly, even spaces like these within the city where people can show up and learn each week on a new element of data and data governance? Control, which is now operationalizing all of the ways that communities want protections through the architecture that you understood, using the standards that you have, right? It's bringing it all together and trying to respond to that. And maybe having a new ethical framework, let's say, on how you assess if this is a responsible use of data. And now, speaking of use of data, that is the last part that you have to be using the data, and you should be keeping track of how you're using that data as you go along the way. Um, because you want to be able to demonstrate to community members as you move forward that things weren't lost to the ether the last time that they provided their data, right? So that's the framework. And then what I'll end off with here, or almost end off, but it's just to talk through some of the other works that we have. So we also have done a literature review on existing models of community governance of health data, where we break it down into components, where then you're able to see, some of the different pieces, foundational pieces to move forward. The city, I told you about the literature review that we did, that's also there. We have a best practices to use socio-demographic data to improve health services for equity-deserving populations. I'm currently working on a piece. We're asked by a community partner to focus on how AI could be used for health equity, if at all. So I tried to find some things in the literature to speak to that. And then also we had a second report on community data governance recently, where a lot of different organizations now, public health unit, there's kind of we have ICES, which is sort of a provincial data platform, and they also analyze data and they receive it from a lot of organizations, so they were also a part of it. So anyway, I talked through some of the tips and tricks and lessons learned from them. It's a pretty quick, easy read, a lot of bullet points because I tried to just make it simple for people to read. And then lastly is actually I showed you the framework. There's an implementation plan that will be hopefully coming out in, it's March, so by May, actually, and it's a long document of essentially, if we were to break down how to implement community data governance at the city, it's like maybe 100 and something pages of just steps, things to think through, things that you have to do, because they wanted lots of detail. So I said, here's the detail you asked for, as well as a preliminary model of community governance that they can work through. So in the end, again, what I hope that you got out of this is that race-based data can significantly improve health equity. We think back to what happened during the pandemic, and that EGAP serves to guide how communities can own data, and using race-based data must be driven by communities. And that's what a lot of different organizations are doing now, and that's what we've been a part of. So that being said, thank you so much for listening.
Thank you so much, Jemal. That was really, really helpful. And it is so nice to see the work, the really hard work that I know you and your team have been doing and made a big difference in the actual day-to-day health of Black communities here in Toronto. I hope you can see all the emoji applause and love in the chat. There are a couple of people wondering when the if when you anticipate the AI for health equity resource being ready. People really, really want to read that. Do you have even a time frame? Like, would it be this year, do you think?
Oh yeah, it would be this year for sure. It's just, yeah, we were asked to again talk about the potential benefits, right? It's
Hmm.
tricky because there are lots of other things, and so it's trying to find that balance of
Right.
presenting how it can be useful without ignoring completely, right? All of the other things to think through. But yeah, it will be coming hopefully in the next, within this year for sure.
Okay. Awesome. Well, so we'll make sure that the recording and all the resources are linked at Talking Data Equity, so you can bookmark that on your computers, and we'll also keep an eye out, and we will let you know when Jamal's new AI report is up. Another question, if you're in the room and you want to ask Jamal a question or share a reflection, you can turn your microphone on or raise your Zoom hand and ask a question. And go ahead and do that now if you're interested. And in the meantime, one of the questions in the chat, Jamal, is I wonder if your work was informed by the Ontario Anti-Racism Directorate identity-based data collection standards. and or the similar standards that have just gone into effect in public schools here in Ontario? And if it was, do you have anything to say about like the comparisons, or are they the same? Are they different? And for people who aren't from Canada, Ontario would be like a province for us. So that's like a state in the United States. And Toronto obviously is a municipality, a city that is kind of within the Venn diagram of the province of Ontario. And there are many levels of government. So, how did you work at all with the Ontario Directorate?
Yeah, so the anti-racism directorate standards explicitly do not include health in it.
Oh,
Yeah. So that
okay.
there's lots of other things. I mean, that's a whole other conversation. But
Right, right.
so no, it was I mean there are parallels for sure. I think
Mm,
EGAP takes it a step further because we're not just focusing on the technical aspects of right how analysis should be or collection should be thought through. We're taking it a higher level of even a community governance to right how it's owned and managed with communities. So I would say, if anything, the Anti-Racism
mm,
Directorate guidelines can support how an institution can do their work,
mm,
but the
mm.
what the ARD also does is doesn't necessarily always speak to like how community health centers operate, right, and the types of data that
Right.
they have. So we kind of have a framework that everyone should just look at and adapt to their own, and perhaps their guidelines will fit, right, in that way. So it's a good
That makes
question.
perfect sense. It's a good question, and it makes perfect sense that that would explicitly, the Ontario level would explicitly exclude health, and then you're working on that. Another question is, this was a great presentation with great outcomes. Curious to see your slides on data governance. Did you or the organization look at data governance frameworks? DAMA.org. I don't personally know what that is. Or another, or I would explain it, but I don't know what it is. Or another group specific to health data to inform your work. I don't know if DIMA is a Canadian or an American or a European organization, and that would make a really, really big difference. Health data is very different in Canada.
No, I can say that so part of the advisory circle that we held, I showed a bunch of frameworks like that one that was like, okay, how should I organize some of this information? I think based on the response that we got is some of those frameworks are a bit too there's a lot of specifics on the technical aspects that we wanted to focus more again on the implementation piece. But one thing that I did take from that is, you remember I focused specifically on the kind of movement part, how it shouldn't be static, right?
Yep.
And I got that from that framework that has kind of like that loopy arrow that points around, because that's the part that I appreciated, is that it showed how this process is supposed to be kind of a moving piece of work. So
Mhm.
again, it was a back and forth. It was considered amongst many other frameworks, but ultimately in the end, I mean, we're trying to figure out what works for the local community and for the local, kind of government context. But it is helpful, I would say. But again, when you're trying to add community aspects and ethics and systemic racism, as I said, some of those things can lose that, right? So yeah, but again, good point.
Yeah. Excellent. Okay. Out of respect for everybody's time, we are going to leave it there. And I appreciate so much, Jamal, you taking the time to, first of all, do the huge amount of work that you've done in the past 5 years, and then also to prepare this presentation for us to share it. We learned a lot. It really helped us end our week on a high note. And I hope that you keep sharing your work with us, and we'll keep promoting it and putting up the links so the community can use it.
Absolutely. Absolutely. No, thank you so much for making this space. It's been, yeah, an amazing time. All right.
Good. All right. Take care, everybody. Have a good weekend. Bye.